Hello, thank you for tuning in to this presentation on caring for migrant farm workers and the LGBTQIA plus population. The reason these two groups are coming together in one PowerPoint is because they are more apt to be treated unfairly at the clinic, the hospital. Um, the migrant farm workers don't necessarily have insurance. I read a really interesting article the other day that still 7 to 8% of gay individuals have been rejected by their doctor, and they won't give them care simply because of their status. And that's really sad. And even a whopping 29% of transgender individuals state that they've been inappropriately touched by their doctor in a sexual manner. Now, these are simply allegations, they aren't proven, but those are still some pretty very high statistics. So we're just going to break these down into two lessons today. I just want to show you we are in beautiful Red Wing, Minnesota on a very nice day. I'm in the park. There's nothing there. I absolutely love this cat holding the violin. And then there's the church. And then there's Brutus. There's a lot going on here today, but I thought it'd be a good place to talk to you guys. So, like I said, this is divided into two lessons. We're going to talk about the care for migrant farm workers. We'll address proper communication, addressing migrant health and personal struggles, and advocating for the patient. And for the LGBTQIA plus population, we'll talk about proper interactions with this group, some best practices, and gender reassignment. But first, let's start off with the S-bar. We're going to talk about Mrs. Milagros Amaro. Just some background. This is an individual who is traveling with her husband and her 3 kids across the country picking crops. The work is bountiful, but the season is short. So they travel where the work is. Unfortunately, these types of people tend to live below the poverty line. They don't have health insurance. They don't get paid a whole lot, but they work so hard. So here's the situation. Milagros and children visit the migrant clinic for care. Milagros has a UTI, or thinks she has a UTI. She's got symptoms, burning with urination, and the children are due for some immunizations. And she also has some health concerns regarding her husband, but he's not present. Basically, the husband thinks that he has a hernia, but he doesn't want to address that because his visa expired. So what do? Well, the Amaros family has been traveling for months across the country harvesting crops. So they arrive for routine care, and they arrive at one of those migrant clinics. These are not permanent clinics. They pop up around the U.S. where migrant workers are working to give them care. So Milagros has flank pain and burning with urination. The staff are unable to find the children's records for immunization, so they attempt to call various clinics. Mrs. Milagros brought a whole bunch of cards from places that she's been, but she doesn't have the vaccination records. What happens in the end is the staff administer the immunizations, possibly again, and they do give Milagros a urine test. Well, the staff tried contacting clinics to obtain records, which is good, but they failed because these other clinics were closed. The nurse practitioner did utilize CDC guidelines and immunized the children again. The NP promised to follow up with the urine test and recommended that Milagros' husband come in for his hernia appointment. That's good, but what do we think about the fact that we re-immunize the children? Well, the CDC doesn't necessarily say that that's wrong, but vaccinations do have side effects. We don't want to give them again if we don't have to. Maybe the staff could have done a little bit more research. I'll kind of show you how. So what was the staff's response to Milagros' incomplete vaccination records for her kids? Well, she didn't bring the records with. The staff did call and they conducted a record search. The staff expressed frustration because the clinics were closed, and honestly, I think the nurse practitioner just said, heck with it, let's vaccinate anyway according to CDC guidelines. But there's a little more research that they could have done on their part. What assumptions did the staff have? Well, the staff assumed that the children were not vaccinated. Milagros didn't know her children's vaccination history. One interesting thing is that on the cards that she presented, her children's surname or last name was different. In in the Mexican line, the mother's side actually holds the last name, but a lot of times people Americanize their children and give them their father's last name. So you might see some differences in the Hispanic population because of that. And then you have to ask yourself, being Milagros was a migrant worker, did the staff question her intelligence and just assume she didn't know? I mean, as a mother, you may know the vaccinations that you gave your children, and even if you didn't, you might know the month or the year that the vaccinations were given, and that might ultimately help narrow down what the immunization was. So I think they could have done just a little bit more research on that part. Just wanted to take a moment to share with you Mick. So every state has something like this. Um, and as a nurse in Minnesota, I have access to MIC and many others do as well. All providers who administer vaccines in Minnesota are required to enter the vaccine, the date, the lot number, the manufacturer, the name and address of the person, and even the person who's administering the vaccine. It's certainly not uncommon for a child to receive an immunization in one clinic and then end up moving to another clinic later in life. Example, a child sees a pediatrician until the age of 18, and then once a legal adult, that child must find a new provider. Perhaps that provider is not in the same healthcare system as the pediatrician, so each state has a place that they have to archive those records. The migrant clinic needs to take the time to ensure and examine each state record instead of just calling Frostproof Florida. There's a whole lot more to it. How to best communicate with Ronaldo while preserving his right to privacy and dignity? Well, many men are self-conscious about their manhood, and it's not unusual to see men avoid the doctor if the issue is embarrassing to them. In the case study, the NP suggests that Ronaldo visit the clinic with his mother, Rosa. That way she could get a blood pressure check and he could get his hernia checked out. His mother could certainly come with, but I feel that the team would fall victim to using her as an interpreter because Ronaldo prefers Spanish. His wife speaks good English though, but not necessarily him. Using Rosa as an interpreter could violate HIPAA and could violate Ronaldo's right to preserving his dignity. During the physical examination, Ronaldo will be asked to remove his pants. If he's laying flat, the staff should keep his private areas covered with towels to preserve his dignity. If it is possible for another male staff member to conduct the examination, that might also add to his level of comfort. Basically, we want him to come in and we want him to feel like a person. He's being treated fairly. And then finally, we have to bring up the issue of potentially being reported to ICE or the Immigration Enforcement Center. Let me just move to the next slide here real quick in on that. For addressing a hernia, though, besides doing the physical examination, if Ronaldo didn't want to do any type of surgery, that is fine. But most treatment nowadays is pretty minimal. If Ronaldo didn't want to do anything, staff could at least give him a support binder. He may be happy to learn that hernia repairs can be done in a minimally invasive fashion with the placement of a mesh in the weakened abdominal area. An untreated hernia does come with a weight restriction. Perhaps Ronaldo is afraid that if he's diagnosed with a hernia, he won't be able to work. A lot of states don't have workers' compensation for migrant workers. As a matter of fact, only 14 states have that right now. So if Ronaldo is out of a job, his financial situation could place his family below the poverty line if it's already not there. So there's a lot on the line for any injury in this category of people. What are some Ronaldo is concerned about his expired visa. Question is, will he be safe seeking care? The answer is actually yes. It is a common fear for an immigrant in the U.S. to illegally fear getting caught. Migrant workers may become busy in their jobs, they travel frequently, and they simply don't have time to address an expiring visa. There are several protections in place for immigrants who need medical care. Staff should let Mrs. Amaro know that her husband's status within the U.S. will be protected during his visit at the clinic. If Mr. Ronaldo wishes to call the clinic to discuss further, staff can reassure him that he is protected from unreasonable search and seizure under the Fourth Amendment. Also, ICE has agreed not to target sensitive locations, such as hospitals. And if they were to go in there, they would need a warrant to search private areas. Staff members are under no obligation to speak to law enforcement about their patient unless a warrant is presented. So whoever will be examining Ronaldo should take the time to emphasize his or her desire to maintain secrecy, dignity, and the desire to give the best care. I also want to mention that in a hospital, care center, clinic, whatever, you should always section off a public area and a private area. ICE cannot search private areas without a warrant. They can walk through public areas, and if they see paperwork laying out, they can certainly take a picture of that. But if you work to keep things quiet and secretive, your patient will be safe. What are some health-related concerns to consider when caring for the migrant agricultural workers? Well, migrant workers experience more traumatic events due to illness and the nature of their work. Infectious diseases like tuberculosis spread when large amounts of people are congregated in small areas. So you'll see more TB, more meningitis, more COVID. And these incidents are certainly going to be higher when people are not separated. Unless working on an organic farm, pesticides will no doubt be used to decrease the weed burden and increase crop production. Farmers in general are at higher risk for respiratory illnesses like farmer's lung or asthma. Manure can produce deadly amounts of hydrogen sulfide gas. That can be devastating to the lungs. People who have inhaled that before have ended up on ventilators and are just lucky to survive. Anyone participating in manual labor is at risk for musculoskeletal injuries. Repetitive motions involving twisting, turning, bending, we've all done that before as nurses, does lead to wear and tear on the back and shoulders. Also, dental care is hard to come by. I tell you guys, whenever I call the dentist, they're booked months out, just months out. And that is me being someone that always goes to the dentist. Imagine traveling and trying to get into a dentist. You can't. Imagine getting into a dentist with South Country Health Alliance, Medicaid. You can't. It is absolutely pathetic. So dental care sucks. Other chronic health problems to consider that might be more hidden, I guess you could say. Diabetes, poor diet, depression, anxiety, those plague those that suffer from lifestyles compounded by financial stress. And then finally, substance abuse may be a perceived solution for those that are trying to cope with stress. Migrant workers lead very different lives, lives that are more difficult than many of us can comprehend. Imagine not having a stable place you can call home and having to be on the move all year long. The nurse needs to listen and express empathy for the situation being presented. Use interpersonal skills to ask questions and learn with humility while not making assumptions. Be bold advocates for this population. Advocate for laws that make it easier to utilize food stamps, receive health care, address illness. Lack of preventative care will result in more emergency rooms, no doubt. And Ronaldo was fortunate to have an immigrant clinic that he could turn to for his hernia, and his wife and children could attend for physicals. This population remains at risk for preventable diseases when immunizations cannot be maintained. Finally, understand the importance of using a professional translator. Some nurses have taken it upon themselves to become fluent in Spanish, but for most of us, we don't have that expertise. So using a professional, knowledgeable medical translator is very important. What attributes Do nurses working with migrant agriculture workers need to refine to function as advocates? Well, use personal and professional skills to keep the patient at ease. Be strong, bold advocates, like I said, communicate well, and have some empathy. This is the conclusion of lesson 1. Know that migrant farm workers are at high risk for more serious and traumatic events. Access to care is reduced due to lack of insurance. Many live in fear if their visas are expired. Immigrants who travel tend to live below the poverty line. There's a lot of exposure to pesticides, poor working conditions. Take the time to communicate, advocate, and listen. We will now move on to the LGBTQ plus population and a case study involving them. All right, here's the situation. His name is John, but he wants to go by Gian, I think we would say. The situation, he's a 23-year-old male who was rushed to the emergency room after getting hit by a drunk driver. He has broken leg and fractured ribs. Nursing staff noticed that he had fake breasts under his shirt and a driver's license with his name listed as Gian. The backstory behind this is that he was with his friends at a football game and they won the championship. They were moving on, they were super excited, and they were going to hit the bars afterwards. But as with any wonderful sporting event, there's always drunk drivers around, and he simply got hit. So John has short hair, slight build, and a thin beard. His goal was to fully transition to female after graduation, but he kind of started the process early. He wanted to get some paperwork done so his driver's license could reflect it. We don't know if he told his family and friends or not. Who knows? But John will inevitably spend some time in the hospital being treated for his injuries, his broken leg, and his fractured ribs. So how will the nursing team react? Will his family find out? So recommendation, nursing staff should be respectful of John and call him by his preferred name and then advocate on his behalf to ensure that his rights are respected. This question's for me personally. How many interactions have I had with people who identify as LGBTQIA+? Well, I'm going to be honest with you, it's pretty slim. When I was in high school, one of my teachers told me that 1 in 10 people classify themselves in this category. And when she said that, all of us in the class kind of looked perplexed because we looked around the room and said, yeah, I don't see anyone that's gay. But some people don't come out until later. I don't have any personal friends that fit into this category, but I do recall caring for a patient in this category. I have spoken with fellow nurses who have provided care to help me gain some insight, but my ability to relate is not very good. I recall that I'm a nurse in long-term care and most of our population is 65 and over. Although our facility will gladly welcome anyone that needs help, referrals for this population have been scarce. I remember the first time I had a classmate that came out as lesbian, then later transitioned. It was back in the day when those types of personal preferences were kept secret. Nevertheless, I feel she was well respected. I've always been one willing and eager to learn, so if presented with a new situation, I would be sure to work with a sense of cultural humility and provide the best care, if at all possible. When caring for an LGBTQIA+ patient, did you know that they were of that orientation before you actually confirmed it? Well, this is kind of a weird question, but the answer would be yes, I knew. Although we never really know a person's orientation until we confirm it, there are clues that may cause us to question. As a nurse, do not assume. Don't ever assume. If knowing orientation is not relevant to the care, don't ask. Many times this question is included in admission screenings and is placed in the patient's file. If you're providing care, you can look in there if you want to, just fine, but don't just walk in the room and ask. I will talk about, though, in a little bit why sometimes it is important to ask. But all right, how do my experiences prepare me to care for people like John? Well, have you ever watched Untold Stories of the ER or Sex Sent Me to the ER? These are great shows. It usually presents a situation that leaves the medical team very perplexed. However, these professionals never really act surprised in their line of work, and they're able to move on with clear thinking and an unbiased attitude. So even if I encountered a scenario like John's, I'd want to quickly move past it and get back to providing care. Surely having a man with a decent build and a beard roll into the ER with breasts attached would cause me to ask a few questions, but it should never detract from the goal of the visit. Remember, not all people think alike. Not everyone wishes to lead the same lifestyle. As nurses, we recognize others' differences, and we have to learn to live with those in this world that think differently, and we should never minimize the humanity in a person. We should still be able to provide solid, empathetic care to all people. What role do I play as a nurse when John's family and friends become aware of his gender reassignment plans? Well, the hospitalization could inevitably expose John's plans to having gender reassignment. Perhaps his plan was to wait to tell. Perhaps he already told his family. Either way, sometimes our timing is not nature's timing. We learn that from life, and we just have to adapt. As a nurse, be aware that things could get ugly for John. If tensions escalate, intervene. Keep the person safe. Respect HIPAA at all times. Don't reveal any information, even if family asks. If John is conscious, that information should really come from him. Take the time to interview John and learn from his wishes. Respect his privacy. Provide resources. Perhaps he needs to see a counselor while he's in the hospital. But be an advocate. Don't consult or give advice. Nurses, your job is to act as a guardian and a defender. You give care. What are some best practices to foster an LGBTQIA plus environment? And would I recognize if I needed help? Well, to create a friendly environment, I would need to work with many people. The American Nurses Association in 2021 lists some ideas to help make your practice more friendly. First, we should customize patient intake forms. Allow multiple options when selecting gender and orientation. There's a podcast called Expanding into the Gay and Lesbian Market, What Savvy Medical Practices Know, provided through the Journal of Medical Management Practice. There are standards of practice that have been published. Those are available by the Massachusetts Department of Health. It's entitled Community Standards of Practice for the Provision of Quality Healthcare Services for LGBT Clients. That's a mouthful. These guidelines go into depth on client rights, intake and assessment, service planning and delivery, confidentiality, community outreach and promotion. And finally, the organization can list its friendly service with the Gay and Lesbian Medical Association. Nobody wants to be discriminated against, and this directory shows the clinics that are committed to providing quality care for this particular population. So just look at my 5 steps listed. And here's an example of a good intake form that is pretty all-inclusive. We give credit to the University of Colorado for putting this together. Notice that it mentions it wants to know what your current gender is, and then what you were assigned at birth, what your orientation is, what your pronouns are, and then it has more alternatives if you don't fit into that category. Let's define some common terms. Heterosexism, that refers to discrimination against gay people based on the assumption that being heterosexual is the only correct sexual orientation, and that's from the Oxford Dictionary. The Oxford Dictionary also gives us the next 3 definitions. So sexism refers to discrimination against transgender people. Homophobia refers to the dislike or prejudice against gay people. And then transphobia is the dislike or prejudice against transgender people. What steps should a nurse take to address all these biases? Unfortunately, we're all prone to bias when we think of certain groups of people. Even the LGBTQIA plus people have biases about each other. It's just how it works. When giving care, put yourself in the shoes of the patient and really try to view the situation from their perspective. Ask yourself some basic questions. For example, what's the cost of maintaining my current perspective? How would it benefit me to change my perspective for this patient? How do my current beliefs serve me, and what do I lose if I change my beliefs? At the end of the day, you have to look inside your heart to make changes. Nobody else can do it for you. And I'm just going to reiterate, it's perfectly fine not to agree with someone's lifestyle. We all are entitled to our own beliefs and ways of thinking. But when you're a nurse, you give care and you do it the right way. You put all that aside. How can we elicit information in a way that allows LGBTQIA plus patients to answer questions honestly so we can get a full assessment? Well, nurses want a good, honest, full assessment. They don't want anything hidden. It just doesn't lead to giving a good care. So I put produce, practice, and find. So conduct an effective interview involves asking questions that the patient is comfortable answering. The nurse needs to know how to ask the questions to keep the interviewee comfortable. Many nurses are fearful of saying the wrong things when discussing gender or sexuality. Some may feel it's not important at all, but just think about this. A gynecologist needs to know a woman's sexual history so he or she can gauge which activities increase her risk for cancer or other diseases. In this case, you would have to ask. But if you're not sure how to ask questions, start by producing a script for yourself and then practice that script with a colleague or a supervisor to find the right questions to ask. Repeating this over and over will increase the nurse's comfort level and put the patient at ease. Conclusion. So the topics regarding LGBTQIA+ may be new for some nurses. Nurses should respect one's chosen identity and then cater to those needs. Evaluate your own experiences and reflect on your level of competency. Consider ways to become a welcoming healthcare provider and become a support and an advocate for patients that need it most. The next two slides list my professional references. Take a moment to look at them. Thanks for tuning in. Have a great day.